actually mentioned foot smell. Did somebody mention foot smell? Do you know what foot smell is actually an indication of? GI health. So remember your teenage boy when he starts to get those shoes that smell worse and worse and worse and worse? That's actually an indication of his GI health or his gut. Okay? And what will happen is his body gets very toxic, his colon becomes more and more toxic, and it comes out through the feet. The smell. Okay? Let's see this.
Is that like you can put garlic between your toes and taste it?
No.
Kind of the same theory?
No. Okay, so first thing that we look at is the way that the heel moves. Okay? So it moves in easily, but when it goes out, can you feel that? It's just locked. Okay? There's no movement on the out. So let me try to show this as best we can to this direction. Okay? When we move her heel in, look how much she'll actually move in. Okay, see that move in? And this is from her neutral position. There's movement inward. Nice, right? When we try to move it out from that neutral position, there's nothing. Can you see that? How locked that is? So she's going to have a tendency to come inward, okay, easily, but not this movement right here. It's locked. So consequently, we'll find some soreness on that side. Okay, it's there. And then she'll also have it on the medial. Okay? Now when we look at this, here is the range of motion that we're looking for between the toes. So we look between second and first, okay, there's our 2 to 1. Between second and third, we look at that movement, there's our 1 to 1. So see, that's kind of mini movement. Then we come over here, see that? Bigger movement, okay? We come over here between third and fourth, and you'll see that becomes even greater. Okay? And then we go from fourth to fifth, and look how big that is. Okay? Now, we'll move back up because that's the length. What if we use a pen? So here's this joint from here to this point right here. So that's one bone. Okay? Then, between these two bones, that movement should be a ratio of 2 to 1. This ratio should be a 1 to 1, 2 to 1, and then 3 to 1. So I actually have on my diagram a little bit off. It should be 3 to 1 ending, not 4 to 1 between the toes. When we look at this, though, when we talk about the neuroma, in between these two toes, this is where the nerve runs, right here. Okay? And that nerve, as it comes through, actually gives the innervation to the toe on this side and this side like this. Okay? Kind of nice, huh? Thank you. So that, when these two bones start to pinch together, as this foot loses that transverse arch and these start to pinch together, can you see where it would lose that home space for that nerve? It actually starts to squeeze that together. What's it going to do? It's going to get mad. Stop squeezing me. Now, as we look at the foot, you don't see a callus build up here. You see the callus build up here. So she has a hyperpronation. So what happens in her case is, because she's lax on the inside, doesn't have the movement outward to catch her, she'll actually hit and throw her foot downward this way. And all of her weight bearing starts to come on this side of the foot.
Yes, she will.
And if she starts an exercise program that's very aggressive, she's going to get the turf toe. So she'll have the tenderness at those little kneecap bones right there. Okay? And she's aware of that also. So that again is something else that needs to be corrected. So take off your other shoe, just so we have a balance. And I want to actually show you something of how.
Is there any significance to why my second toe is almost as large as my big toe? Is that any related to this at all? Or is that just me being special?
Special. And it's actually...
It indicates higher intelligence.
It does.
Yes!
That's the only thing that I've ever
I bet
heard.
your toe is so short.
The great apes have toes like that, right?
Yes. The greater the ape, the longer the second. So go ahead and stand and just see how your feet feel. And then we'll do a couple of things. Just walk over there and back. And we'll just show a couple of corrections on the feet.
I don't even understand.
Yeah. No, I don't think that's how that works. So we'll show a correction for the feet. Now this is a technique that Dr. Gonzalez from California created. And I think he He's spent some time in neurology and laser treatment, and I think he's done some really nice things with respect to evaluating the foot. Okay, so the first thing we want to look at is how can we activate movement here. The foot moving up and down will engage the foot. And what we want to do is engage this calcaneus so it will actually start to move inward and roll across. Okay, so what she's going to do is draw her foot up, yep, and then down. Okay, so up and down, and she's just going to do that for us 4 times, up and down. Kind of sore, isn't it?
I'm actually getting a Charlie horse between my big toe and my next toe.
You can feel it.
Well, you can see it. Look at
Yeah.
me.
Look at that.
I mean, I can't not do that.
You're not
Okay.
going ow, 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 ow.
But and you can actually see right there, see the Charlie horse from the spasm right there in the big toe?
Yeah.
So just by engaging that calcaneus, she actually already gets
I'll be having a
spasm.
cup outside the door after we went to a big
Tuppence the bag.
Yeah.
Did you tell him you have polio?
Scoliosis. Okay.
Wow, yeah.
Calming.
It's coming, yeah, but I have literally a Charlie horse in my arch right now.
Yeah. So I'll have to jump ahead here for just
Oh,
a
sorry,
second.
I'm ruining your demo. No, I
No,
don't have a
you're
Charlie
not.
horse, so I'm fine.
Yeah.
Oh, I love you, Jared.
Do you see,
That's
see, where
good.
see where that toe is? That's not a Charlie horse. All we need now is a Celatersica on top of that Charlie horse.
My little cowboy's going crazy.
That's classic. Barbara's going to be a medical doctor originally. Now she assists Dr. Robertson.
No, you.
Excuse me, she's his clinical partner and
No,
hygienist.
not even that. We have to pretend like it's a hygienist office that hired a dentist.
Oh, okay.
Or she's
He's
unhappy.
tentative now. You guys let me know with feedback if I should keep him on.
That's so good.
Good. Everything you mean?
Oh, yeah.
Good.
I mean, no, it probably at least 21 days.
21 days. That's a good start.
Anything
right?
less, no.
Okay, so as we looked at this ratio of the foot, the next thing we wanted to evaluate is up in this area of the foot. So we see there's a loss of juxtaposition here to this toe. So the 4th toe needs to move, and you will actually have tenderness here, and we'll have tenderness underneath. It's mostly in the top. Okay. Then we'll see between the 3rd toe, and we'll check that range of motion as well, and that also has a limited range of motion. But it's actually in the bone that's just above. In the first cuneiform, we'll adjust that upward. Okay. Then we look here at the 2nd and the 1st. Pretty good movement back in here, but we also need to adjust right here in that first cuneiform on both sides for the 2nd and 3rd ray. So we'll fix those for her right now. And thank you. She's good.
Well, she uses those to clean people's teeth.
This small one for the people with all the extractions. Right?
How come I didn't get that today?
Okay, foot up and down again, and down, up and down, up and down, up and down. Good. Again, up and down. That's great. Good. And one more time. That's it. Good, and relax. Okay, last thing that we want to look at from here is just bringing the toes back, and then we'll make a correction in between. Now this is a lot of times where a person who has really bad neuromas, when we push in between the toes, that will just light them up. Okay, it's so painful. But again, you'll usually see some type of callus there forming. You'll see a complete loss of this transverse arch, and then you'll actually see what I call spooning. Okay, that top of that foot could actually hold water, because instead of having a transverse arch downward this way, you'll actually see above the foot, it'll look like a little spoon. You could actually catch water in that depression. Have any of you seen that?
Well, that's how Barb drinks out of a stream.
Well, there's a lot of work pent up here today. You can hear.
More tentative all the time.
Your job is waning. Okay, so we're going to bring these toes back, and we'll just give a little impulse here, here, here. Now, the interesting thing that I've actually seen with this is that these little nerves, because they come from so high, when we had that picture up there before, and we showed that cauda equina and the sympathetic parasympathetic tone, I've actually seen where this loss of a transverse arch can actually influence bladder tone. And I've seen ladies who have had, when they say, oh my goodness, I'm getting this stress incontinence, I jump on the trampoline or laugh with my kids, I'm losing a couple little drops. We've actually made adjustments in the foot like this before, and particularly on this outside, which is the S1 dermatome, and we've actually seen tone come back to the bladder just by doing that. It's really, I think, fascinating, but again, just one of those tidbits that would be for your information because we found it, and if somebody listening would benefit from that, great. Okay, then we look at the talus, her talus positioning. Actually, let's just look again. So you can see there's a little bit better motion.
Already?
You feel that?
Yeah, definitely.
Okay, we'll come back and reevaluate here. Good. And I want you to actually walk on it and just see.
Okay.
Compare the right foot to the left foot. Just walk over and back and just see how that feels.
Oh, the right foot's alive and the left foot's dead.
Yeah. Crazy, huh?
Yeah.
Kind of feels neat. Now here's a really neat thing that I found. If we get the feet to start to function correctly, imagine what we can do for the person and their ability to stand upright. If my feet feel great, how good do I feel standing? Like $1 million, right? It just changes my whole body when my feet feel right. Think about it. When you're wearing high heels, ladies, with the narrow toe, and you've been on them all day, how much do you want to be standing at the end of the day? Compared to when you get home and you have those really nice, soft, fluffy slippers, and you just feel like, oh, I can't wait to get home and get those babies on, right? Or 21 days on the beach, of course, right? You just feel like you can stand longer. Let me show then an example for her, and then we'll fix her other foot as well. Let me show you then how we'll maintain that. So this little magic wonder, right, that all of you thought was to just spend your husband's money and weekend time, is actually the magic tool that we use to maintain the function of the foot. Okay? What we want to do with the magic dimpled ball is roll forward and back on the transverse arches, okay, or excuse me, the longitudinal arches. So we'll go forward and back and find all the tender spots. So while we're sitting, we'll take this and place it underneath the foot, and we're just going to roll the ball forward and back, and basically massage the foot. Then we want to go to the transverse arch and go side to side on that. And then we actually want to try to monkey toe the ball and pick the ball up with our toes. Okay? Ideally, if we can pick the ball up with our toes, we want to hold the ball with our toes as our heel stays on the floor and rotate the foot inward and outward. Inward and outward. So again, we'll keep the heel on the floor, and then we'll grasp the ball with the toe, and we'll turn the the forefoot inward and outward. Inward and outward. So you can see how that would engage those small worms in between the toes. Okay? So again, we'll grasp it with the toes and go inward and outward, inward and outward. Now, for those of you who are saying, my toes aren't long enough to get over this.
There's no way my toes.
Yep. So, those of you who cannot grasp over that small of an object, go to the next size down. A boulder, okay? Even if you like, go down to the river or to the stream and find some small stones, okay? Go and engage that little Turkish saddle. Get the little cowboy out there for a little walk or an engagement in the morning or evening, and go find some stones that you can use. Okay? What I like to do even is have people get 21 marbles or 21 small stones, keep them in a cup at their desk, and then just pour them out on the floor and pick up each one of those marbles and set them inward, and then pick each of those up and keep the heel on the floor and set them outward as well. Okay? And do that on both feet, and what you'll find very quickly is these arches will strengthen and we'll get the tone back into the foot so we don't get that cramping Charlie horse as we maintain the range of motion. by keeping the heel on the floor, we're actually getting the rock side to side. And then by turning the forefoot forward side to side, we're engaging those small muscles, the lumbricoids again, side to side as we're gripping. And that small foot tone actually maintains then activation of the spine. So watch this. So go